Hello, everybody. I'm Michael Overstreet. So I'm a computer programmer, robotics consultant, 3D printer consultant. And so your topic about robots and healthcare is a pretty it's a nowadays question. And why I say that is that as I do consulting and working with robotics companies, there's a lot of interest in using robots and automation in healthcare, hospitals, doctors' offices, dentist offices, you name it, almost even in homes where you have somebody who needs help, they're sick or they're having limited mobility and so on. There's a lot of interest in this area. Of course, there's a lot of work has been done in this area for the past 4 or 5 years. This is not something new, but one of the silver linings to COVID-19 is that it's helped with companies develop new solutions to help people, give them the money, the research, and the interest in healthcare and automation in hospitals and helping people out. I'm a visual person, so I like showing pictures and videos and stuff of the robots to kind of give you an idea what I'm talking about, because sometimes it get kind of boring to just have me talk for a half hour or 20 minutes or so. And then you can ask questions during or after we get done. So let me share my screen and kind of show you some of the robots that I've been talking to people about or I've seen or a lot of enthusiasm behind. So one of the things is that there's been done a lot of work on in the last 4 or 5 years is robots that help and assist in surgeries. The Vinci Robot is a great example. Oh, there was actually good. There's been a lot of work on the Vinci Robot and other robots, and where this helps out is that the precision, the capabilities of the robots are a little bit better than the doctor, so the doctor will actually monitor the surgery, help with the surgery, and guide the robot when it's doing the procedure. Now, the great thing about this is the doctor doesn't have to be, in a lot of situations, the doctor doesn't have to be with the patient. The doctor could be in another room. Actually, the doctor can be in the same town or within a few hundred miles because the latency is not too bad. So they can actually do surgeries over the internet. So this limits so let's say if your doctor for some reason can't be there, he can still monitor the surgery, help with the surgery, supervise the robot during the surgery. And there's a lot of advances been made in the surgical robots, making them so that it actually is better than a human because the instruments are smaller and it's easier to get into the person's body and do the surgery. So this, when people think about automation in the healthcare, this is usually what they ask me first, is about the surgical robots and assistant robots. And there's lots of advances been done in the last 4 or 5 years on this, and you're going to see this more and more. So don't be surprised if you do unfortunately have to go into the hospital and have a surgery. Don't be surprised in the future if a robot doesn't do the majority of the work with the doctor supervising or guiding. So that's usually one of the biggest examples. So the next one I want to show you is this has also been a lot of work on this in the last 4 or 5 years. So we got exoskeletons. So the military I know has a lot of work in here lately. But just think of the help that exoskeletons give to people as they get older, or for some reason they're out of the surgery, or can't walk for whatever reason, or are having trouble walking. There's been a lot of work being done on exoskeletons. Right now they're kind of big and kind of huge and can kind of get in the way. But the benefits is that not only does it help the person be able to lift heavy weights that they couldn't do This also helps with people who have limited mobility in their arms and legs because, not all these robots, but some of these robots are developing an interface between the mind and the nerves so that you don't have to have fully functional legs or arms to use a, exoskeleton. So think like aliens and stuff like that. These things will just get smaller and, better as time goes on. It's also great for, hospitals to see you have a nurse in a hospital that can't get help and has to lift a patient. They could use an exoskeleton to increase their strength and, capabilities. So usually, why I use these two examples first? These are the examples lots of people are talking about right now. Exoskeletons and surgical robots. And helping, now in, and like I said, this development is going on for at least 4 or 5 years. So this is kind of advanced now. So, it's here now. Like I said, but things will just get a little bit better and better improved as the time goes on. So, and there's all kinds, like I said, uses for the exoskeletons as far as assisting nurses and doctors in a hospital with a patient to people who are, have limited mobility, especially as we get older. They can have an exoskeleton to assist them in walking and moving. So this, like I said, this is a very, the topic that lots of people are talking about in the last 6 months or so. So one of the byproducts of COVID-19, the silver linings of COVID-19, is we kind of thought about how we can prevent, diseases, pandemics, flu seasons from becoming an issue. And one of the latest developments is using, spray disinfectants defoggers. The cool thing about these spray disinfectants defoggers is they're just using ionized water, so it's safe. You can actually spray yourself with this stuff and not hurt yourself. So it's basically a mild form of chlorine water, like in a pool or a swimming pool, and it sprays it into the air and on the surfaces. And this is a great way to do a quick disinfectant. Think about how many people lately in the last six or 7 months, they have to put on all those PPEs, face masks and shields and gowns, and then they got to clean a possibly contaminated area that has COVID-19 on it, or maybe our flu, whatever, disease or, virus is very active in the environment. And hospitals are a breeding ground for, diseases and bacteria. So this is a great way to help, hospitals maintain, a safe environment for both the patients and the doctors and the nurses. And like I said, you can spray this with the patients and people in the room because it's just chlorine water. Now, this robot also has another capability, which is, UV light. So that when it's in a room without a person, it's kind of hard to see, but it actually has UV lights here on the sides. This robot is autonomous navigation, which is pretty simple and pretty easy to do. It's just technology we've had for a while. So this robot is autonomously navigating from point to point and just does a regular patrol through a hospital, doctor's office. It goes from point to point to point, disinfecting the room. And then with its sensors, it can say, hey, there's nobody in the room. But those lights actually will turn on when nobody's in the room and disinfect the room using UV light. And UV light is really good because it destroys the cells and the DNA of the virus and bacteria, making it inert. And like I said, this is semi-new technology. There's been a lot done since January on developing these robots and getting them ready for the hospital use. So you'll see these not only in hospitals, but, think of public areas like restrooms, stadiums, even schools. Schools would be a great place for these robots. So if you have a school, it's opening up. It doesn't just have to be for COVID-19. This could be during the flu season. You can have the robot drive around and spray bathrooms and common areas and classrooms. And then when somebody's not there, they can zap it with the UV light.
Michael, we had a question. Is there a name for this robot?
They just call this the M2, the Keon robot. It's actually, this is a Chinese company. There's a lot of work and development going on in China because this is where the pandemic started. There's a lot of demand in China right now, and India. It's also becoming big with robotics, but you'll start seeing this in the U.S. There's also a technology called far UVC, which is a more safer version of light, because UVC is actually emitted by the sun, but our atmosphere blocks it, and it is harmful to us because it can give us really bad sunburns and damage your eyes. That's why having an autonomous robot drive around with these UVC lamps is great, because it can drive from room to room, and then when a room is empty, it can then turn the lights on. You'll start seeing this technology more and more. And when schools start opening up next year, I wouldn't be surprised if you saw a disinfectant cleaning robot at your school.
What is the cost on these type of robots? We had a question in the chat about that.
Most of these robots retail for, the great thing about China is they're great at developing and hardware and stuff. Most of them retail for around 10,000 US or less. It's not really sophisticated. You just got basically UV light fixture, defogger. Think of a Halloween, those Halloween defoggers that shoot out fog. Very similar technology. These not really advanced robots. Autonomous navigation is basically done called it's SLAM, which is it uses a LiDAR sensor, kind of like a Roomba. Think of a Roomba. It's a more advanced Roomba, and it uses a LiDAR sensor, a laser sensor to map out the room, create a map of the area it controls, and then you can do software and programming. You can set waypoints, so it just drives from point A to point B to C. D just does this little drive around and does this all autonomously, and then it has sonic sensors and other types of sensors which it can use to navigate and not avoid running into people and see if people are in the room. Here's another thing. This is another robot. I wouldn't be surprised if you see this. Walmart's and Sam's Clubs and Target are experimenting and slowly putting these robots out. This is an autonomous floor cleaning robot. And some of these robots also use ultraviolet light. You're going to probably see these at Walmart's and airports very soon. Sam's Club has been doing a lot of development on these, and they just basically go around and autonomously clean the floors. And what's great about robots is they're great for a simple, repetitive task that you and me would probably get bored at. Think of how if you've got a mall that's got thousands of square feet, you have a robot that can do this. So you can have a worker. You can also do these manually, but you can train the robot both manually and autonomously. So you're going to see these robots more and more. Airports are starting to use these and so on. And it's like I said, this is simple technology that's been in use for a while. Walmart's been using experimenting with floor cleaning robots in Sam's Clubs for the last 2 or 3 years now. So you'll see these everywhere. Now, this is another great thing getting advanced in the last 6 or 7 months. A lot of people want to experiment with these, use these robots in bathrooms like at a school and a hospital. And you can constantly set this robot up to go into a bathroom periodically and clean the bathroom. Just think of how much PPE use is going to be reduced, because somebody's not going to have to dress up in a hazmat suit and go into a bathroom now to clean it. They can have a robot go in there, and a robot can't get COVID-19. That's the great thing. Robots can't get COVID-19. They can't transmit COVID-19. And all you have to do is just periodically clean the robot's surfaces, and you keep them safe for everyone. So this is another great use for robots. Lots of people the other question I get a lot is, when can I get this in my home? I want a robot in my home to clean my bathroom so I don't have to do that. This is going to happen soon. Maybe not tomorrow, but I wouldn't be surprised if you go to a public, excuse me, a public, place and, one of the bathrooms is being cleaned by a robot in the next year or so. They're really good. This is not a very hard task to do. Once you program the robot using, stop motion, so on, you just basically train the robot by moving the robot around. There's also a lot of work being done on making robots smarter and then programming the robots using a virtual environment. So you have a virtual map of your area that you want the robot to drive around, and then you do everything virtually. You do all the training virtually, and then once the robot has been trained virtually and you have thousands of simulated hours of the robot in the virtual environment, then you can put him in a school, a hospital, an airport, and it'll be really safe. Now, this may be a little bit off. This may take a lot more work and development, but nurses and doctors are being overloaded right now. This is where intelligent, smart, robot, nurses, doctors, assistants are going to become sort of huge in the future. You can use these both autonomously and as a telepresence robot. You'll probably see telepresence a lot sooner than you're going to see autonomous doctor, nurse assistant robot. But the cool thing is that, with 5G coming out and now there's talk of 6G coming out, that we have the bandwidth to do, video and audio between, a doctor or nurse on the same floor in the same building very easily. And this robot can constantly navigate from room to room and just check on people and see how they're doing. And if it notices an issue, the person's having an issue, they can then communicate with a person, and that person can then telepresence through the robot into the room and check on the person using visual cameras to see how they're doing. And this will take off a lot of stress off of nurses and doctors, especially during times of a high flu season or COVID-19 issues or anything in the future. You can have like one on every floor, and this can take over some of the rounds nurses do. It can also take water, and food and other stuff to the patients when needed, and has an arm, and it can actually go to the patient's bed and give them the water, using the arm. But this may be, I don't think this is going to happen just overnight. This is probably 6 months to year, 2 years before we start seeing these autonomous, robots, in hospitals. Like I said, you'll probably see a telepresence robot first, where they have a screen and then you can interact with the doctor and nurse through the screen and through audio. But this is some of the latest stuff. This is like a Texas company. And, this is a great example. This is a very cheap robot. This is not very expensive. Really, all it has is some motors, some wheels, a stand, and a tablet, that has voice and touch screens. And so instead of wasting lots of PPE, so if you have a ward that has COVID-19 on it, so you don't have to, suit up and between patients, you can have this, robot go from patient to patient, room to room, and then you can easily interact with, the people through telepresence. Like I said, 5G is great because it allows for low latency, and great video and audio communication real time with no lag. And a nurse remotely can be at a station, or a doctor can remotely be at a station and check a patient out, ask the patient questions. And in the future, as technology gets better and better, we're going to have lots of sensors the sensors on the robot can then check on the patient, see how the patient's doing, check his temperature, oxygen levels, all kinds of really cool things that robot sensors can do. And this is technology that can be used now. This would really help next year if the hospitals could start integrating these robots in and help the stress level and the demand and on the workers in the hospitals. And then finally, this is also probably a few more years out, but a lot of work's being done on this. So it's using machine learning AI to diagnose patients, CAT scans, X-rays. So basically, you can through programming machine learning AI, you can train a computer AI to diagnose a patient. So think about the demand doctors are under, the stress their doctors under. You can have AI monitoring patients for symptoms and for stuff, and they can help a doctor. And maybe in the future they can replace a doctor, but right now they're more of a help for the doctor. So if a doctor can't be everywhere, can't be with every patient. So a lot of diagnosing work, emergency room work in the future, AI, machine learning using all types of really cool sensors, vision sensors, X-rays, temperature sensors, and so on, infrared sensors. This is checking X-rays to see if you have pneumonia. And this is basically, like I said, this is deep learning, machine learning to help doctors diagnose patients. So that's another area that's a lot of work and a lot of money is being spent on. So those are some of the examples that me and my friends and when I consult and talk to companies, the work being done right now on robotics and AI. Like I said, it's a field that a lot of people are talking about right now. There's a lot of issues and problems that the robots can help out. PPEs are a great example. So a doctor or a nurse doesn't have to change PPEs and clean themselves from patient to patient. You can have the robot do that. And like I said, robots can't get flu. They can't get COVID-19. They can't transmit that. And then you just clean the robots from patient to patient by just spraying them with ionized water, chlorine water, and it kills the viruses really fast. I think we can move on to questions. That's pretty much all I have. Let's see if there's any questions that you have that, about robots and hospitals and automation.
What are the exoskeletons named again?
There's a couple of things about the exoskeleton. So in Japan, there's a real shortage of workers. And so they're having, well, in the U.S. it's the same thing. So think if you have a nurse that has to move a heavy patient, she can put on an exoskeleton suit, go into the room and pick the patient up that she wouldn't normally be able to do. Or there's other uses for that. Heavy equipment you can move around. But also think about somebody who's had a broken leg or has, for whatever reason, can't walk. They can strap on an exoskeleton suit and that exoskeleton can walk for them or help them walk. So there's a couple different things that exoskeletons do. Help somebody lift something really heavy and help people who can't walk or use their arms as well.
Does the exoskeleton have a name or just exoskeleton?
Oh, usually they're called exoskeletons. There's some proprietary names for what they are, but exoskeleton just, it's like it sounds. It's a skeleton. It's like, some insects have exoskeletons. It is giving us an enhanced strength, agility, capability by strapping on servos and, suits and stuff and so on.
Someone asked, is it kind of like prosthetics?
Yeah, it's sort of like prosthetics. You would actually have, each of your joints would have a high-powered servo so that it would enhance your strength and your movements. So if you have limited strength or movement in an arm, the exoskeleton can enhance in your strength and your movements and your agility. The military is really looking into this as far as helping soldiers carry heavy things. So this technology can be used in hospitals and places of businesses where you need 2 or 3 people to lift something really heavy. The exoskeleton can enhance your strength and your agility so you can do stuff that you wouldn't normally be able to do.
So they asked, is that more like a suit then?
Yes, think of it more of as an external suit. There's nothing, exoskeletons or, so like a prosthetic would be if you're missing like a parts of your hand or your arm, then you would attach that to that, and that would become your hand arm. Exoskeletons are more of a outside attachment that enhances that, kind of like a suit, like you're saying.
And someone asked about, the robot where it can talk to the patients. Is that just basically what people are doing right now with Zooming with their doctors, or they have opportunities to do more with them through those robotics?
So Zoom is a great example of how we adapted to the COVID-19 and how we're trying to limit social distancing and stuff. So robots are great with social distancing. So you can basically, something similar to Zoom, you can telepresence into a robot, and you can also drive that robot around. It can be autonomous, but you can drive that robot around, and you can use video and audio cameras to see your environment and drive the robot around. And then you can, through the cameras and through the screen, some of those are touch screens too, you can interact with people, remotely. So you don't have to be in the same room as a person. You can actually, with 5G and some of the more, as internet speeds up, you don't even have to be in the same city. You can be in another state, at another country, and you can drive around a place of business, a home. This is great for if somebody wants to visit their parents or their grandparents. You could use a telepresence robot in their home to visit with them and interact with them just like you would through Zoom. But this allows you a little more interaction. You can actually move around. You don't have to be limited to a camera on top of your computer. You can actually have a mobile camera that can move around a place or move from room to room. And it's a great way to increase interaction. Think if you have somebody who can't go to school because they have asthma and it's the middle of flu season and they don't want to be exposed to the flu and going to school. You could have a telepresence robot for the student or even for the teacher to help improve that interaction and make it better. Think of it as an improved, better Zoom.
I know I saw a news story before about places like in rural Texas, they were using these robots, and they were using it a lot for specialists, like if people came in with strokes and they had no specialist nearby, and that way they could connect like a stethoscope and some other things to the nurse would do that manually so that the doctor could hear.
Yeah. So the great thing about doctors are kind of being overtasked right now. They have lots of patients and lots of full hospitals. So a lot of doctors don't work just for one hospital. They have a private practice. They have a hospital. They may consult with multiple hospitals. So telepresence robots are great because the doctor doesn't have to drive to the hospital. The doctor doesn't have to get on an airplane. Think if you have somebody, like in Africa who's got this, really, exotic or, unknown, disease or something. You can have a doctor telepresence into the hospital, a consult, be there. It gives them a better interaction because they can have on their screen, the doctors can have all the different, instruments monitoring the patient, but they also can have video and audio. They can actually talk to the patient. They can talk to the nurse or the doctor in the room and say, hey, would you please do this or that, or take their temperature, do this. And they can consult a lot better. I think it gives a lot better consulting and capability than just a Zoom call.
Okay, thank you. The students were just kind of discussing some pros and cons to the robots. They said somebody still has to clean the robots, but that's still going to use less PPE than a person, right?
You're probably going to see these in public schools and hospitals and in public places. You'll have these doorways, and when you walk into a place, you'll basically be sprayed with chlorine water, mist. So you'll have maybe like a doorway that's maybe a couple of feet long. The first thing that happens is when you walk up to the door will not open until it takes your temperature through a camera. Then the door will slide open. It's kind of like checking the metal detector at an airport or a scanner. You'll walk into this like a little booth doorway and you'll get a quick mist, chlorine water. You just have to close your eyes so you don't get the chlorine in your eyes. You close your eyes and it'll mist you real quick. And they even had far UVC, which is safe for us. And then the light will turn on for maybe a minute and it'll be all around you. And then you walk in. And this will be a quick way to disinfect people. Same thing with the robot. Because you only have to disinfect the outside of the robot. You can have the robot drive through this little doorway or to this little cabinet between patients. And it'll be disinfected within a minute or two.
For these robots, will these be helpful for the COVID to go away or no?
Yeah, that's a great question, but think more than just COVID and it's not really going to have COVID go away. It's just going to help us contain COVID. So when you have a new disease show up, this is the next one. We don't know what the next pandemic, where the flu's going to be bad next year or COVID's going to be bad next year. It's not going to make it go away. It's just going to help us manage it until we have a vaccine. So when we get a COVID vaccine, it's going to be great. But what happens if we have a really bad flu season? We can use these robots during a really bad flu season to help out. And then we can always think about a robot. You don't have to lay a robot off. So if everything's great and there's no pandemics, there's no diseases, you may not need these robots. But so you can put these robots in a storeroom somewhere in the hospital or the school. And whenever they're needed, you can bring them out. You don't have to lay them off. They don't have family or kids. So whenever you'll probably see big warehouses where you have these robots, telepresence robots and cleaning robots. And then whenever there's an issue, kind of like the ventilators, whenever there's an issue, the government can break these robots out and send them to hospitals and places to help out. It's not going to get rid of COVID-19. It's just going to help mediate COVID-19 until we get vaccines. Or whatever the next flu season or whatever. Whenever that happens, we have something to help. Because think of all the doctors and nurses that are just overstressed and overworked right now. If they had a robot to help them out, it would decrease that stress. That's kind of what robots can do. Robots are not a cure-all. Robots aren't going to replace us anytime soon. Think of them as helpers, assistants, butlers.
With the robots, they are gonna take some jobs and some people the janitors to clean the bathrooms. Will the janitors sell the jobs, or will they work together, or will the robots be kind of temporary?
Yeah, well, see, a lot of people are worried about this, but right now, robots are really good at repetitive, simple tasks that most people, I would get really bored if I cleaned the same bathroom every hour for, 8, 9 hours every day. So robots are really good at these repetitive tasks, and we're really good at creative tasks, inventing, creating, programming. Robots are going to need a lot of work on maintenance and battery charging and cleaning. So you can have these people that clean, janitors can become robot supervisors and shift managers. First, I don't know how involved your school is in FIRST, but I think FIRST is a great opportunity for people to learn about robotics. And then for summer jobs and night jobs and weekend jobs, you use that FIRST knowledge that you're getting, and you can go out to a place of business like a hospital or a restaurant or a business and say, hey, I've been doing FIRST for 2 or 3 years now. I know lots about robots. I can jump in and I can help you maintain your robot, change its batteries or fix a servo motor or program your robot. Cause I've been doing FIRST. I think FIRST and other robotics, stuff in schools is going to be great for the future workforce. And there's not a lot to changing the battery, wiping a robot down. There's more to programming. That's where you guys come in. If you're really interested in programming, designing, engineering, electrical engineering, mechanical engineering, I would definitely tell you those are going to be great job opportunities in the future to do robotics, because there's going to be robots and then there's going to be demand and need to maintain and work on these robots. So whenever you have cool new technology, it always creates more new jobs. You just need the training. You just need to know how to do those jobs. So it might displace some workers, but there's also going to be lots of cool new opportunities, especially for you guys when you get out high school and college, if you have some background in programming. And like I said, FIRST is a great place to kind of get started learning about robotics. So just to kind of wrap up, don't be scared of a robot. Robot's there to help, and think as a robot as an opportunity for you. There's going to be a lot of really cool jobs out there in the future. At least I think they're going to be super cool. Programming robots, making robots safer and better and more social. Disney is a great example. Disney right now is working on robot actors. So when you go into Disney, instead of having a human walk around dressed up as your favorite Disney character, you're going to have a robot walking around as your favorite Disney character. So there's going to be all kinds of really cool things that robots are going to help us out in the future. Opportunities and cool things, interaction that we can have with robots.
Did you guys all learn something new today? Yeah, some interesting stuff. Did anybody else? Did someone have one more comment?
The Disney robot was sort of animatronic, but it'll actually be able to move or walk, like a dog or a human or R2-D2. Think how cool it's going to be when you're in a Disney park and R2-D2 is driving around interacting with you, or C-3PO is walking around the park and you can go up to C-3PO. And it's not a human in a costume. It's actually a robot. And the robot can talk to you and communicate with you, ask questions. You can ask it questions. The robot can help you around the park. Instead of having a human walk you around the park, you may have a robot that can be a tour guide for you at a park.
Interesting things. Okay. Thank you so much. I think we did all get to learn some new things today, and they asked some good questions. So tell them thank you very much for talking to us today, and make sure you fill out the survey, okay? If you didn't get it on here, it's also on the Google Classroom. Okay. Thank you so much.